Hi, I'm Dr. Lalit Choudhary, Senior Consultant Plastic Surgeon from Sir Gangaram Hospital, New Delhi. So I'll be speaking about rhinoplasty, and it's one of the most commonly talked about surgeries in the circle. Rhinoplasty or the nose job is getting more and more patients in every OT nowadays because of the social media involvement. People are very conscious about their face. Now there are two kind of rhinoplasties mainly, which is closed and the open. The open is 90% of the time people are doing, which is actually you won't find any scar. It's just below the nose, very few 2 or 3 millimeter cut initially seen, and long term you don't even see that, and everything is done from inside. So it's not actually that open image in the picture which we have in the mind. So the closed is you don't have even that scar, but that is qualifying only for few limited cases. Now rhinoplasty, it's a 3 to 5 hour surgery, and in most of the cases, unless very small corrections are required, downtime is long relatively, because in 1 week time, 7 to 10 days, we have the splint over the nose, and we say that comfortably you should be joining back around 3 weeks time, because by that time most of the swelling has started coming down, and even the bruises and very other facial changes of edema will also settle down. Then rhinoplasty patient have issues like fixed ideas about this kind of nose I must have on my face, or that kind, that generally we must counsel patient for a significant time to tell them that nobody else's nose can be superimposed on your nose. It is what you have in hand that can be modified, and that too has the limitations. Like significant changes can be done, but often what happens that surgeon feels the best possible job done, but the patient is not satisfied, or the vice versa. So counseling is required in that case. Otherwise, they have psychological issues post-op. And best time to finish a rhinoplasty is the first time. Generally, second or third revisions, they don't lead to the similar results what we can get in the primary case. As far as the complications are concerned, generally we don't expect much complication if it is done by the trained plastic surgeons in a setting like we have our Gangaram hospital setting or similar hospitals. It should not be done in a small place where the post-op bleeding control or the appropriate anesthesia support is not there, because it involves face. There is some amount of controllable bleeding which can be easily controlled if we have all the good setup. Then rhinoplasty pre or post-op is shown to the patient, and often we find that they are satisfied once we show them the pre-op, what they expected and what we have come up with. If you have any queries regarding rhinoplasty, open, close, or even nowadays we are having liquid rhinoplasty in which the injection of fat or injection of the filler is done, which is a OPD procedure, you can contact us at Sir Gangaram Hospital or Chisel Clinic. I am Dr. Lalit Choudhary. Thank you. Take care. Have a good day.